is Vashti. I'm going to be your nurse practitioner student today. I'm just going to be examining your head and your chest. Can you tell me your name and date of birth?
Tracy Permana, date of birth is 10/20/95.
Okay, patient is alert and oriented, well groomed, well nourished, no sign of distress. I'm going to start off with your head. I'm going to take a look at your skull. Just lean forward. Okay, skull is no masses palpated, any tenderness?
No.
Okay, no tenderness, normal cephalic, no trauma indicated, hair is evenly distributed, fine and smooth. And I'm just going to take a look at your face. Face is symmetrical, no lesions. Going to palpate your temporal arteries. Any tenderness?
No.
Okay. Now I'm going to move on to visual acuity. Do you wear glasses or contact lenses?
No.
Okay, so just cover your left eye and you're going to read the last line for me.
LTFPH,
Okay, now you're going to cover your right eye and read the line backwards.
HPFTL.
Visual acuity is 20/20 bilaterally using the Rosenbaum chart. Now I'm just going to look at your external eyes. Eyebrows are present, symmetrical, no lesions. Eyelids are present and symmetrical, no lesions, no rashes, no redness. Lacrimal glands are intact. Medial and lateral canthus are intact, symmetrical. Gonna take a look. I'm just gonna pull this area down. Your conjunctiva is pink and moist bilaterally, no discharge. Sclera is white bilaterally. Optic disc is intact. Okay, now I'm just going to test your pupils. I'm gonna shine a light into your left eye first. And now your right eye. Pupils are equal, round, and reactive to light at about 3 millimeters in size. Now I'm going to test for direct and consensual light reflex. Shining the light into your left eye first for direct. Direct light reflex is seen. I'm going to shine it again, looking at your right eye. Consensual light reflex is seen in your right eye. I'm going to do the same on your right eye now, testing for direct this time. Direct light reflex is seen. I'm going to shine it again in your right, looking at your left eye. Consensual light reflex is seen, which is normal. Now I'm going to test for conversion. So I'm going to have you look straight at the wall for me, and then you're going to look at my pen when I tell you to. So right now pupils are dilated. Now look at my pen. I'm going to move it in. Okay, now pupils constrict and the eyes converge. Now I'm going to test for visual fields. So just cover your left eye for me. And how many fingers am I holding up?
2.
Okay, cover your right eye for me. How many fingers am I holding
3.
up? Okay, visual fields are intact. Now I'm going to check for extraocular movements. So just keep your head still and follow my pen. I'm going to go in an H motion. Extraocular movements are intact. Cranial nerves 3, 4, and 6 are intact. No signs of nystagmus. I'm now going to take a look at your red light reflex. I'm going to turn the light off. I'm going to look into your right eye first using my right eye. From a distance, red light reflex is seen. I'm going to go in. Okay, there's no opacities. The optic disc is seen. It's yellow. There is a cup to disc ratio of 0.3. No lesions around the macula. I'm going to do the same to the left eye. The left eye reflex is seen. Gonna go in. There's no opacity. Optic disc is visualized. Cup to disc ratio 0.3. Optic disc is yellow. No discharge. Noted. Okay, now I'm gonna turn the light back on, and I'm going to move on to the nose. So I'm gonna test for patency first. I'm just gonna occlude this nostril. Breathe in and out. I'm gonna do this one. Breathe in and out. Okay, patency is, noses are patent bilaterally. Now I'm going to assess for smell. So I'm gonna close your eyes. I'm gonna occlude one nose and just tell me what you smell.
Coffee.
Okay, very good. Now the other one.
Alcohol.
Okay, very good. Okay, so smell is patent bilaterally. I'm just going to palpate your nose now. Tell me if you feel tenderness.
No.
Okay, no tenderness. And now I'm just going to look inside of your nose using my otoscope. I'm going to pull this up and forward. I'm going to go into the right side. Okay, the nasal mucosa is pink and moist. There's no nasal polyps, no discharge, no erythema, no lesions. I'm going to go into the other side. Okay, nasal mucosa is pink and moist, no nasal polyps. Septum is midline. There's no deviation on both, no redness, no lesions. Okay, now I'm going to take a look at your mouth. Lips are pink and moist. There's no ulcers, no redness, no lesions present. Now I'm going to take a look inside of your mouth. If you can just open for me. Okay. Tongue is midline. There's no lesions, no ulcers present, no white patches. Good dentation. Gums are pink and moist. Buccal mucosa is also pink and moist. No lesions, no redness, no scarring. I'm going to take a look at the hard and soft palate, which is both pink, no lesions. Under the tongue is pink and moist, no lesions noted. Now say, I'm going to look at your tonsils. Tonsils are +2, no erythema, and no exudate. Okay. Now I'm going to test for hearing. The first thing I'm going to do is test Rose hearing. So I'm going to have you cover your left ear, and I'm going to go right behind you and tell me if you hear what you hear. 1, 2, 3.
1, 2, 3.
Okay, very good. Now cover the right ear. I'm going to go on the opposite side. ABC.
ABC.
Okay, hearing is intact bilaterally. Now I'm going to perform a Weber test. So I'm just going to strike this, put it on top of your head. Tell me if you hear down one or both ears.
Both.
Okay, normal Weber test. Now I'm going to do a Ryan test. I'm going to strike it, put it behind your mastoid process. Tell me when you hear the sound stop.
Stop.
Okay, and when does it stop behind your ear?
Stopped.
Okay, I'm going to do the same on the other side, putting it behind the mastoid.
Stopped. Stopped.
Okay, normal Ryan test bilaterally. Now I'm just going to take a look at your auricles. Auricles are symmetrical, no lesions present. Now I'm just going to palpate your tragus. Any tenderness?
No.
And any tenderness behind your mastoid process?
No.
Okay, I'm going to take a look inside both your ears. I'm going to start off with your left ear. I'm just going to look inside. Okay, tympanic membrane is present. It is pearly gray. Cone of light seen at the 7 o'clock position. No perforation, no nodules, no masses, no lesions, no drainage seen. I'm going to take a look at the other side, the right side. Tympanic membrane is seen as pearly gray. Malleus and pars flaccida is seen and intact. Cone of light is seen at the 5 o'clock position. No discharge, no swelling, no mass is seen. Okay, very good. Now I'm just going to assess your neck. I'm going to take a look at your neck. Neck is symmetrical, no masses or bulging. Now I'm just going to palpate your lymph nodes. Tell me if you feel tenderness. I'm going to start with your preauricular,
No.
postauricular, occipital,
No.
tonsillar,
No.
submandibular,
No.
submental,
No.
superficial cervical chain,
No.
deep cervical chain,
No.
posterior cervical chain,
No.
and supracurricular.
No.
Okay, no tenderness upon palpation. I'm just going to take a look through your trachea if you can look up. Okay, trachea is midline. There's no deviation. Any tenderness?
No.
No tenderness, no masses palpated. I'm going to take a look at your thyroid now, which is between your cricoid cartilage and your suprasternal notch. Any tenderness as I'm palpating? No tenderness. The lateral lobes are felt. No masses felt. Okay, now we're going to move on to your chest. I'm going to look at your anterior chest. Anterior chest, there's no lesions, no retractions, no signs of distress. Your AP lateral diameter, lateral AP is a good 1:2 normal ratio. Now I'm going to palpate your anterior chest. Tell me if you feel tenderness.
No.
Okay, very good. Now I'm going to percuss. Okay, all areas are resonant, no dullness heard. Now I'm going to auscultate. You're just going to take deep breaths in and out for me. In and out, 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 in and out. Okay, areas are clear upon auscultation. No wheezes, bronchi, crackles heard. I'm just going to have you turn to your side for me this way. Okay, I'm going to inspect the posterior chest, no redness, no swelling. I'm just going to look under, no lesions or anything. And I'm going to palpate. Tell me if you feel tenderness.
No.
Okay, no tenderness. Take a deep breath in and out for me. Okay, chest expansion is symmetrical posterior, and I'm just going to check the anterior. Just breathe in and out. Okay, also symmetric and anterior. Now I am going to assess for tactile fremitus. When you feel my hand, say 99.
99, 99, 99, 99.
Okay, vibrations are heard bilaterally. I'm now going to percuss. Okay, all areas are resonant, no dullness heard. Now I'm going to assess for diaphragmatic excursion. I'm going to palpate mid-scapularly. I'm going to have you breathe normally. Then you're going to breathe in, exhale, and hold. Okay, this is where dullness is heard. I'm just going to mark this line here. And now you're going to breathe normally. Breathe in, exhale, breathe in, and hold your inhalation. Okay, dullness is heard here upon inhalation, and this is 4 centimeters, which is normal for diaphragmatic excursion. Lastly, I'm going to auscultate all lung fields on the posterior side. Deep breath in and out, 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 in and out. In and out. Okay, lungs are clear bilaterally, no wheezes, rhonchi, crackles heard. I'm going to test for egophony, so when you feel my stethoscope, just say E, okay?
E, 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 E.
Okay, E sounds are heard, no A sounds, no consolidation, which is normal. Now I'm going to test for whispered pectoraloquy, so when you feel my stethoscope, just whisper 1, 2, 3. Okay, 1, 2, 3 sounds are barely audible, muffled, which is normal for pectoraloquy. That concludes the exam. I'll give you some privacy to get dressed.